Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about the things you should know before you graduate your medical coding program. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so you are going through your medical coding program and you're wondering what is going to happen next. Once you've completed your program, you know you're going to sit for a certification. The number one thing that you need to know before you graduate your medical coding program is which medical coding certification should you sit for. Either sitting for the American Health Information Management Association's CCS, the Certified Coding Specialist, the CCA, the Certified Coding Associate, or the CCSP, the Certified Coding Specialist Physician-Based, or if you're going to go with AAPC, the American Academy of Professional Coders, flagship credential, the CPC, the Certified Professional Coder. And if you're brand new with no experience, you will have an apprentice designation after this for 2 years. That is their time requirement. However, there is a way to get around the time requirement. If you go through an approved AAPC program and you complete Practicode, which is an educational product offered with AAPC, if you do these two together, you can certainly have your CPC right out the door, okay? So that's their way of doing that. So, but not to stray too far from the subject, you need to know which certification you're going to be sitting for before you graduate. And the reason that I say you have to know this before you graduate is because the number two thing that you should know before you graduate medical coding school is that you should know when you are going to sit for the certification. The good rule of thumb is at least between 30 days and no more than 90 days when you complete your program. And the reason that I say no more than 90 days is because this gives you a time that you need to take your exam. A lot of people don't have this time. They don't know about this time that once they've completed the program, when to sit for their certification. I get the emails from people. They say, Blue, how soon should I sit? How do I know that I'm even ready? If you know you have a target date, like 90 days, you know, that you need to get this done and over with and sit for your certification exam, at least you have an idea of where to go. And that's really very important because the more structure you can give yourself, the more that it will make it easier to attain your goals. You know, reaching your goals and getting through this type of program, medical billing and coding, or even just a medical coding program, they call it different names, but essentially you're learning about medical billing and coding. When you're getting through this program, it's already a lot. And so there's a lot of, sometimes if you're in a school, sometimes there is structure, sometimes there's not structure. A lot of times there's no structure because you're often doing this at your own pace within a certain window of time. But if you know how soon you're going to take your certification, which certification exam that you are going to sit for, this is already going to give you a clearer path to study. Because sometimes people don't know and they will try to just wing it once they get done with the school. Well, it depends on which certification you want. You know, there's 2 certifications that require you to know inpatient and outpatient coding. You have to know the CPT book as well as the ICD-10 PCS book. And that is the CCA, the Certified Coding Associate, or the CCS, the gold standard of medical coding credentials. If you are taking one of these two, one or the other, you do have to know both inpatient and outpatient coding. Now, if you were just trained in the outpatient side and you just you're only really confident with coding the CPT book as far as like ICD-10 PCS versus CPT, you're more confident with CPT, there are 2 outpatient credentials you can choose from. AHIMA has the CCSP, Certified Coding Specialist Physician-Based, all outpatient coding. And then, of course, AAPC has their flagship credential, the CPC. So all outpatient coding, right? Certified Professional Coder is all outpatient coding. So you have your choice of whichever one you want to sit for. All 4 of these are asked for widely all over, okay? And before you say anything about the CCA, oh, no one asked for it. They do. You just have to know how to look for it, okay? When you're looking for jobs, and this is the number 3 thing that you got to know. When you're looking for jobs, they're not always going to be listed under medical coder. Some facilities, some doctor's offices will call medical coders either medical billers, medical billing associates, and they're actually, if you read the description, it's actually referring to a coder who also does billing at the same time too. So you got to kind of watch that. They'll refer to them as health information technicians, health information techs, medical records tech. Again, medical records, you think of the medical record, but there are some that refer to medical coders that way. So it is all about knowing the language of the job listings. I've done many job listing reviews. You can look through my videos. Please take the time to look through the videos. It's really helpful. There's over 900 videos now. And all you have to do is look through the little spyglass and just type in whatever you want to. And trust me, I've pretty much done every episode known to man when it comes to this subject. But I try to get creative, okay? So, but with that in mind, if you are looking at these jobs, you want to make sure that you're reading the actual job listing. The other thing is, I think we're on number 4 now. Number 4 is that everybody is going to ask for experience. This does not mean that you do not apply because you don't have experience yet, right? You've never worked in the field before. You still want to apply anyway, even though they're asking for experience, because why? You have training. You have training, and once you get your certification, you have your certification. This says that you are competent to code in this field. It's all a matter of just getting out there and getting into your first job, which leads me to the number 5 one. You need to arm yourself with a very good resume. No more than 2 pages, okay? 1 page is okay, no more than 2 pages. Do not go back more than 15 years because that's all they're going to run you back. 10 to 15 years is what employers will run you when they're doing a background check on you, right? They will run 10 to 15 years back. That's all that needs to be on your resume. You need to be able to list all of your skills, all of your hard skills, everything that you were trained on. I don't want to hear that you are a team player, that you are organized, that you have a smiling face. I do not want to see that on anybody's skill list. And yet that's all I see. And a lot of times brand new medical coders neglect the fact that they were trained in ICD-10-CM. If they were trained in ICD-10-PCS, that needs to be listed separately as well. CPT, HCPCS, medical terminology, anatomy, pathophysiology, HIPAA, medical law and ethics. So all of these things need to be listed there along with all the other things that you know. What about Microsoft Office Suite, right? Do you know Word, Excel, and PowerPoint? If you do, you need to make sure that those are on there. So that's something that you have to think about when you're writing your resume. If you are going to farm it out, if you are going to farm it out because you say to me, Blue, I've looked through your videos, hint, hint, and all your videos that talk about resume tips for brand new medical coders, I don't think I can write my own resume, even though I've given y'all like all these ideas. And I just want to farm it out to somebody because I don't feel confident. You need to get rid of that because you're going to need to write in this field. Oh, yes. We do write emails to our colleagues, to our supervisors, and most importantly, to our providers. So you're going to have to get rid of this. I don't write. You're going to have to get rid of that. You're going to have to get used to writing. But for all intents and purposes, when you're looking for a job and you really want a standout resume, there are plenty of resume writers on LinkedIn. I am a resume writer myself. What sets me apart from all the other resume writers, some are professionals who do this for many different fields, right? I am a medical coder who speaks medical coder. And so that's what sets me apart. I have written many resumes and I have plenty of happy customers who have left feedback for me on LinkedIn, so you're more than welcome to check it out. Medical Coding with Blue, I'm on LinkedIn as. So check it out there. My rate is in the description box below, so just if you're interested in setting up a session with me, please check the description box, and that has all the information about getting in contact with me. So, but that aside, you need to have a good resume. Do not neglect the resume. And my resumes all come with cover letters as well. I meet with the individual so that I can get a personalized experience of writing this, and I kind of can draw out more of the skills that people kind of don't really think about. And so that's why I have a meeting. There's a 30-minute Zoom that is included with all of my resume rewrites. So that's just another thing that you got to know. But with that said, resumes go a long way, especially really good resumes that say all of the things that you were trained in, and that when you're talking about your past positions, all of the transferable skills. So that way a employer can see that, they can say, okay, this person is on the ball. They know what they're doing. Because there's nothing worse than somebody who is lost and they're showing that they are lost. They are like, I don't know what to do, and everybody wants experience. That should not even be on your radar. Even if it says we want 3 to 5 years experience, you go ahead and send your resume anyway, because a good resume is going to get noticed. Now, employed medical coders who have experience are going to stay where they are unless they are moving or they are unhappy and they want to move someplace else. So sometimes employers are not always going to be able to get what they want. Of course, they're going to say that they want somebody who has experience. Why? Because they don't want to have to train. But if they do happen upon you who is brand new and just, got your credential and you're out there and you can pass one of their assessment tests, that's going to give you a better chance of getting in versus you being scared off for everything that you see, that they all want experience. So you have to think about that. All right, guys, that's just my advice anyway. This is Aunt Blue's advice when it comes to just, this is what happens after you get done with school. And these are the things you have to think about before you get out of school so that you can be prepared. The people who feel the most lost are the ones who don't have a plan, are not prepared, and they're not doing their research. You have to do your research, folks. You really do. The amount of questions that I get in from people that I know are not doing their research is astounding. And this really scares me because this is the next generation of medical coders that we're going to have out there in the real world. These people who don't want to do their research. Guys, get with the research. You have to do your research. And that's another thing that you have to know before you get done with school, is that you will have to research. It's not about who is going to train me when I get in to my job. No one is going to train you. They're going to expect you to already know how to code. Another thing you got to know. You are going to be expected to already know how to code. Yes, you may have questions that you don't really understand, and maybe you've done your research and you're going to ask somebody for help. That's okay, but at least show them that you're trying and you're attempting to do your research, so that way they know that you're not just sitting there waiting for somebody to give you the answer. Because if you have that attitude, you won't last very long. Because senior coders, some are from the old school way of thought that no one trained them, so they're not going to train you, unfortunately. And then you will have some that are like me who are happy to help, but we also need to see you trying, okay? It's a lot, yes, I know, but this is something that we all went through. Us as veterans, we all went through this. So again, it's about arming yourself with knowledge, with research, and making sure that you are still going to practice even when you are out there looking for a job. I have been the recipient of many email, and yes, I said email, that says, well, Blue, I graduated last year. I've been applying and somebody finally gave me a chance and they're sending me a test and I have forgotten everything about coding. Then why were you still continuing to send out resumes and apply at jobs for coding if you had stopped practicing? And now you've forgotten everything that you learned. It's not a good place to be in. I've been asked, can you give me a crash course on coding again? No, that's not what I do. I do tutoring, but I don't do crash course, because crash courses with medical coding, because you should already still be continuing to work on it. You should be reading your coding guidelines if you're a student, And when you get out of school, you need to at least review them every now and again, so that way it can stay fresh in your mind, okay? Because guarantee you, these employers, oh yeah, they're going to be asking you those questions. They're going to be asking you, what do you know about the guidelines? They're going to be extremely detailed in their questions. So you need to be ready, okay? I'm telling you all this not to scare you, but to make you aware and just get you ready and prepared. You know, this is what you're going to go into. This is what you're going to walk into when you get into the real world. Yes, this is a great field. It's going to be around for a very long time because AI still has not gotten sophisticated enough to read the provider's mind, okay? And these software programs are only as smart as the people who are designing them, okay? And yes, things do get sophisticated more with time, and that's okay. But, you know, you still would have to do something that is literally going to interpret every single thought that the provider has. So, again, until then, we are still going to be here. We are still going to be needed, all right? So don't even worry about that. Worry about making sure that your resume looks good, that you're going to be proactive, that you know which certification exam you're going to be sitting for, that you take your exam no more than 90 days once you've completed your program, because the longer you're out of your program, the more you're going to forget the things that you have learned. And that is a very hard thing to come up against, because sometimes people will say, well, I have my diploma in medical billing and coding. Is that good enough? No, it is not. Completing a program but not having the certification, that says a lot, because employers are like, well, we need the certification. Some will take you on with just a diploma, but they'll say, hey, we want you to have a certification within a year's time, or within 6 months' time, or within 9 months' time, whatever they decide. So your employment is contingent on that, and they're just essentially waiting for you to kind of just finish up. But if you don't have a certification, remember, you cannot start off with what a medical coder would make, okay? So that's another thing you got to think about. Now, we don't talk about money and specifics on my channel. Never have and never will, because every place is different. But that is something that you have to be aware of, because even though you completed a program, it doesn't necessarily mean that, oh yes, well, I've got a diploma and I can just apply for jobs. Yeah, you can apply for jobs and you could probably get hired, but the just having that credential is going to say a lot about your investment in this profession. Okay, so that's another thing that you got to know. So I hope this was enough for all of you to think about. I mean, I know it's a lot to think about anytime, because it's so much when you're going into a brand new field. But it is possible. Don't get discouraged right away. Whatever you do not get discouraged right away, because there's going to be a lot of people out there that are going to be negatively talking, and they're going to be saying, well, I can't get it. Oh, I'm trying to sneeze. I'm trying to get a job and I can't get a job, and they're complaining and going on. And sometimes they'll be complaining on LinkedIn. I have started a campaign now to stop complaining on LinkedIn. Okay, just don't complain. It doesn't make you look good professionally. Do not beg for a job on LinkedIn. Do not talk about, why you're doing this, as far as like, oh, you got to support your family. Everybody's trying to support their family, okay? Or just support themselves. So that's not something that you need to be bringing to LinkedIn. Medical coders, while there are thousands of us, it is also a very small community. Everybody knows everybody. And there is less than 10 degrees of separation at any given time. Somebody will know somebody who knows you, all right? And so that's just the way that this industry is. So prepare yourselves, prepare yourselves, prepare yourselves. That is the solution that I'm giving all of you. There's not a whole lot of change that I can bring on, other than this is a solution that I can give. I'm not just up here talking about the problem. I'm giving you guys the solution. Prepare yourselves. Be armed with a good resume. Know when you're going to take your certification. Know which certification you're going to be taking. These are solutions. These are not just talking about the issues and the problem. These are the solutions. Know which one you're going to. And if you are curious about the different medical coding certifications and which one should you sit for, I have done that many times where I have explained the differences in the medical coding certifications. So if you're interested, make sure that you hit the little spyglass, on my YouTube homepage and type in there whatever credential that you're looking at, that you're wanting to sit for. And I guarantee you're going to have a ton of videos that come up. So that's my advice anyway. But I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. And I hope that I will see you for Friday's live. I have my once a month live on Friday. I will be live tomorrow, 7:30 Friday, 7:30 p.m. Central Standard Time. So I will see y'all then. If this video helped you, I hope you like it, subscribe, and I will see y'all again. Bye.